yeah, so I can kind of talk to you.
Yeah, exactly.
Okay.
So you don't have to worry about that thing. It's not there. It's recorded, but it's not there.
Yeah. You can have me for all the bloopers.
This is gonna be great bloopers.
Heather, did you get anything done? Okay. Okay, that's ready.
So today we're talking about fitness and hormone health. You know, I have a bunch of questions for you, Dr. Heather, and I want to make sure that our audience understands how these two combine. So the first question I have for you, how do hormones like cortisol, estrogen, progesterone, and testosterone influence energy and body composition?
Right. So, like, just going back to look at cortisol for one thing. So, cortisol is our primary stress hormone. It's our fight or flight hormone. And with that, cortisol can be a great thing in regard to like waking us up in the morning, giving us that boost. But if it's not regulated well, we're going to start to see sleep disturbance, weight gain, different distribution of fat tissue, just because it's not being regulated in the way that it should. It is actually very responsible for like mobilizing or bringing glucose into the cell. So that's one of the main functions of cortisol. But in excess, if people are like highly stressed and there's a lot of cortisol being pumped through their body, it can actually break down muscle, right? Because the body is going into like not trying to add more muscle and give more energy, or sorry, what I should say is, it's not trying to like build muscle because that takes energy. It's in fight or flight. What do we need to survive? And fat is what it can survive longer on. And chronically elevated cortisol is going to lead to, like I said, fat gain, poor recovery from injury and from the gym, and also sleep disturbance. And sleep plays a huge role in how our body is going to actually perform and you start to kind of see changes at the gym.
Wow. So what are common signs that a client's training results are being limited by hormonal imbalance?
Sorry, but we didn't talk about estrogen.
Oh, okay, that's okay. Hold for a moment. We'll go back. I'll re-ask the first question just so we can kind of go over it. And then we'll get into the second one, sorry.
Okay.
All right, so I have a bunch of questions for you. And we'll start off with this one. How do hormones like cortisol, estrogen, progesterone, and testosterone influence energy and body composition?
I'll just start again too. So cortisol is our primary stress hormone. It's our fight or flight hormone. It helps to wake us up in the morning, get us going through the day. But if it's continuously pumping in excess, we're going to start to see more fat distribution. We're going to, if it's also in excess, we're going to see muscle breakdown, and not also being able to sleep and sleep deprivation, which then is going to lead to poorer recovery. We're also going to start to see more adipose tissue being developed as well. In regard to estrogen really helps support like insulin sensitivity, right? How our body is actually using insulin to get glucose into the cell. When it's high, we do see more fat distribution. You know, some women will see more in like through their abdomen. And it also can, I just wrote something else here. It also influences our serotonin, so our mood and actually how we produce collagen.
Oh, wow.
So that's one of the main things in estrogen. Low estrogen is gonna lead to increased body fat. It's also gonna lead to joint pain, mood disturbance. And when it's in high, we're gonna see more fluid retention, breast tenderness, and heavy cycles. So women, I am talking about it more in regard to women, right? But that's also going to happen with males too. That can also happen if testosterone is in excess and it's not actually being used productively. They start to see some of those it gets shifted into estrogen,
Yeah.
where we might see breast development in males, right? They might be more moody, more fluid retention. That can happen in both men and women.
Okay.
In regard to progesterone, progesterone is a very calming hormone, and it's actually supported. It's a GABA supportive hormone. GABA is one of the neurotransmitters which helps relax the body. So this is why, if there is a hormone imbalance, right, the third week of our cycle, we should actually be feeling quite good. Most people don't, because there's usually a progesterone deficiency. Progesterone also helps balance with estrogen, and it also helps with sleep and body temperature regulation.
Yeah. Wow.
But when we have low progesterone, which is usually the case, we start to see anxiety, PMS symptoms, sleep disturbance, and shorter cycles. So, for women, it might be like, oh, sweet, I only had a 2 or a 3 day cycle. That's not ideal. It doesn't show that the body is working efficiently. And lastly, testosterone. So testosterone is driving our muscle protein building or synthesis. So the building of muscle proteins. And it's supporting motivation and also libido, giving us that extra energy, right? If there's extra testosterone, you feel great. And it's also going to improve insulin sensitivity as well, right? And blood sugar regulation when it comes to working out, super important.
Oh, absolutely. Thank you. So, for the second question then, what are common signs that a client's training results are being limited by hormonal imbalance?
Right. So, common things that I see are you're training hard, but you're not seeing the results in the gym. I'm just going to actually hold this because I wrote a list of them down. Okay. That persistent belly fat, even though we're calorie restricting or trying to limit our calories in order to help with either weight loss or putting muscle on. Extreme fatigue after a workout, like you don't feel like you're recovering as fast, and you almost have to take a day off after the gym in order to recover. Again, cortisol plays a role in this as well. If cortisol is pumping at the wrong time, you might get that wake up between 2 and 4 in the morning, which is not ideal because cortisol should slowly be starting to rise, not be enough that it's waking you from sleep at that time. Because then that's going to lead to more sleep disturbance. In regard to for women, right, it can disrupt menstrual cycles or make a heavier cycle. Libido will drop. And we see also plateaus in training rather than, you're increasing your training load and weight that you're doing at the gym, but you're not seeing those improvements. And then it can also, it does have an effect also on the thyroid. So we start to see dry skin, hair thinning, which can be that hormone dysregulation, but it can also then start affecting the thyroid as well.
Okay. Wow. Thank you. Which lab markers or assessments do you find most useful when investigating hormone-related fatigue or weight gain?
Right. So, in regard to hormone-related fatigue, I would actually just run a full hormone panel. And as a naturopathic physician, I can run a lot more tests than are sometimes run in the regular medical system because patients are paying privately. Okay, but you could also go ask your family doctor for a hormone panel in order to just kind of get the basics of what's going on. But the one thing is that sometimes that test is run on not the ideal day. So as a naturopathic physician, I'm looking to tell people when is the best day to do that so that we can see the results of if something is high or if something is low. In a hormone panel though, we'd have testosterone, estrogen, progesterone, DHEA, sex hormone binding globulin, and cortisol. cortisol super important, whether it be that AM or morning cortisol. Are we getting enough of a spike to actually wake us up? Another test is a salivary test that we can actually do a 4-point cortisol panel throughout the day. So we can actually see the points on through lab results as to what's going on.
Wow.
So some of the other tests, so there's the hormone test, there's metabolic markers, so that's where we look at fasting insulin. How much insulin is your body producing when you're fasting, when you're not actually needing to make insulin for food? There's still always some amount of insulin going in. Blood sugars are super important. Inflammatory markers, thyroid panel would be another one, and also our vitamin D levels, our ferritin, our iron, right? Men and women can have high or low of all of these, and so it's good to kind of see where somebody is sitting.
Yeah. Wow. So how does chronic stress change hormone patterns and affect training recovery?
Right. So when it comes to, like I said in the first question there, in regard to cortisol, okay? If cortisol is elevated, we're getting muscle breakdown, we're getting fat storage, which is limiting what our results are when it comes to recovery. If we don't have enough either progesterone or testosterone, that's also going to have an impact on our training and chronic stress. Sorry, I wrote notes and then forgot. Okay, so yeah, with chronic stress, elevated cortisol, that's our fight or flight hormone, suppressed progesterone, decreased testosterone, low libido, right? Because if the body is stressed, it's not working optimally, and how our body is dealing with it, it's what is absolutely necessary when it comes to stress. And we can also start to see with stress, our body becomes more insulin resistant. So the body, when you eat food, will give insulin, but if you're insulin resistant, the body is actually having to produce more insulin to actually combat that food. And looking at it further, insulin is a fat storing hormone. So if people are insulin resistant, they're actually going to put on weight no matter what they're eating because their body is having to produce more insulin. When it comes to training under chronic stress, without either adjusting the volume of what you're doing or how much weight you're lifting, you're going to not see those gains. You're going to see a plateau in actually building muscle. You're going to increase your injury risk because if you're under stress, the body is not going to heal damage. And if you're continuing to work out, you're going to start to see tearing. You're going to get, like I said in that first question, delay in recovery, and then also more fat retention. So even though you're working out, that stubborn fat is still there.
Wow. Love this. So what lifestyle interventions do you prioritize first for hormone regulation?
Right. So one of the main ones, first and foremost, is sleep. Okay? If we're not getting a good sleep, we're not recovering, and we're not then ready for that next day, right? Our body is not recovering and repairing while we're still doing things through the day. So at least 7 to 9 hours of sleep is ideal to help with hormone regulation and actually with recovery. And my favorite one, and all my patients know this, protein, adequate protein, okay? I usually tell my patients, unless, and this is, not medical advice in what I'm giving here because each patient is individualized. We have to do what is optimal for them. But if you're looking to try and make gains, it's usually about 1 gram of protein per pound of body weight.
Yeah.
Doing resistance training, right? You can't just do cardio. Resistance is so important. So lifting weights, building muscle, right? Muscle helps to increase our metabolism as well. And the more muscle we have, the better our metabolism. Blood sugar stability, right? So not just with somebody that's diabetic or insulin resistant, everybody needs to kind of look at their blood sugars. And most people don't because it's just kind of taken for granted The fact that, oh, my blood sugars are level, my body does it.
Yeah.
As a type 1 diabetic, I know this very well because anything that I do, if I'm stressed, if I'm working out, if I, I'm starting to get sick, my blood sugars are going to change in accordance, even with certain types of food. So I feel super lucky with that because I know exactly what my blood sugars are doing, and that's one place that I can really fine tune that. And vitamin D, right? Vitamin D is super important. Light exposure, especially in the morning, getting that morning sun, even just 10 minutes upon waking, if you can get out in the sun, can really actually just also restart set up your circadian rhythm, which then optimizes everything else moving forward. And also, don't drink coffee all day. So if you're gonna have coffee, I love coffee, okay? But having it in the morning, right? Don't start having an extra one in the afternoon or the evening, because then it goes back to that first thing I said in regard to sleep. We're gonna impact sleep.
Yeah. Oh, I'm glad I don't drink coffee.
Lucky.
I shake like a leaf. How can strength training specifically support hormone balance in men and women?
Right. So in both men and women, it's actually going to increase our testosterone production, okay? Both acute and chronically. So in working out, right, and actually being in the gym, our testosterone levels boost, and also over time. It does not mean that, if a female is lifting weight, they're going to get too much testosterone. No, but testosterone is a feel-good hormone. You ask any guy that's taking testosterone, they're like, I feel 10, 20 years younger because we're getting that boost. It's a happy hormone, for lack of a better term. Also in regard to insulin sensitivity, right? I talk about insulin resistance, right? If we are working out, our body can then actually optimize the glucose that we're having from our food, and less insulin has to be produced, and the insulin is working more optimally. Cortisol, right? Stress is going to be helped over time with that. Improving estrogen metabolism, right? Because when we're looking at how hormones are made, right, it feeds into estrogen, progesterone, or testosterone. If that testosterone pathway is not being made as much, more gets fed into the estrogen pathway. And then preserving lean mass during menopause. So this also goes back into lifting weights. I think it is so important for everyone to lift weights, and especially when women are getting close to menopause, either perimenopause and into menopause, keeping up with lean muscle mass is incredibly important. And then for women, heavy lifting does not raise cortisol. It's actually going to lower it over time, and it does help in supporting progesterone baseline, which then improves your metabolic health. So if your metabolism is working more optimally, you're going to actually lose weight, you're going to keep muscle better, you're going to feel better, and all the things that we're looking to do when it comes to if we're not feeling well.
Wow. Thank you. What are common supplement strategies you use, and when are they appropriate?
Right. So again, this is on an individualized basis, right? But certain ones that can, and this question is, I don't want everyone to just take my list of what I've put here, right? Because it's different depending on what somebody's going through. But magnesium bisglycinate primarily, can really help relax the body before sleep. It also helps with relaxing the muscles, so that if those muscles are relaxed while we sleep, we do get that repair and ready for the next day. Adrenal support can be very helpful, right? Because our adrenal gland, which sits above our kidney, is the gland that actually produces cortisol. And like I've said through this entire presentation, cortisol, is needed, but at specific points. And then, those are kind of like my main ones. There are a few more, but keeping it nice and simple, like magnesium, adrenal support. There is some amino acids as well, like phosphatidylserine, but on a patient basis or individualized basis. So that's more for like high stress, cortisol dysregulation, which a lot of people are going through. For like estrogen metabolism, fiber is super important, right? Because it helps to bind that excess hormone or deactivated hormone and get it out of our system. I find a lot of, women that I see in clinic with hormone dysregulation, if their bowels are not moving consistently, we actually see more of that hormone dysregulation because those deactivated hormones are not getting filtered out and eliminated from the body.
Yeah.
When it comes to low progesterone, right, there are progesterone modulating supplements that can be very helpful, right? So a progesterone modulator, if progesterone is high, which it usually isn't, it helps to bring it down. If it's low, it brings it up. And then there are some B vitamins as well specifically that can help with that. And then for testosterone, zinc, super important. Vitamin D, which is important for all of them. Creatine, which seems to be the supplement of choice right now, but it's really important and it helps with that muscle rebuilding. And again, that's where it's going to help with that testosterone. And then for insulin resistance, we got to look at things that bring your body into a state to be more insulin sensitive. So,
okay. So, when should clients seek medical evaluation versus lifestyle coaching?
Right. Okay. So lifestyle coaching can be great, but when not everyone, you can't just cookie cutter that everyone, this will work for everyone. Yeah. Whether, there was phases where it was like, let's do the keto diet, let's do the paleo diet, let's do the carnivore diet. They're all great, but for different people. Yeah. And so when it comes to getting medical advice, usually people, for me as a naturopathic doctor, I want to see people before there's actually a problem so that we can prevent it. Yeah. Usually by the time people go see the doctor is where things have really tanked. They are completely exhausted. They're not sleeping. They haven't had a period in months, right? There's like excessive weight gain. They are so fatigued that they can't even get up and do daily lifestyle activities. And yeah, those are kind of the main ones. I wrote down some other ones, but yeah, but I want to see people way before that, right? I probably want to see people when they're thinking, oh, I'm pretty healthy, I'll just go see a lifestyle coach. That's when I want to see them to make sure that we stay on that level to keep them like that before things go down, and then we have a lot more work to do to build them up. But that's usually when people end up seeing the doctor. Yeah. But as a naturopathic doctor, I'm looking at that health optimization and prevention of these things happening.
Absolutely. So how do you approach perimenopause and menopause from a naturopathic lens?
Yeah. So again, I'm looking at hormones. I'm looking at progesterone, what's happening with progesterone, what's happening with their estrogen, both with testing and what they're symptomatically coming in with, right? This is where when we do that testing in the month is super important, right? If we have estrogen peaking, towards like the beginning of our cycle, progesterone peaking, into like week 3, if we're testing in that middle, we're not getting a result that's going to show us if it's high or low, right? It still shows as normal because it's in that limit, but what's actually happening when they are peaking. So super important for women that still have a period that we actually test those hormones on specific days. It's not just, I have my lab rec, I can go any day, which sometimes doesn't get, vocalized to the patient on, I need this test on day 3, I need this test on day 19 to 21. Other kind of factors like when it comes to perimenopause, whether you have a period or not, insulin sensitivity, right? Our insulin's not working as optimally. And then muscle loss starts to kind of accelerate. So priority, in regard to that are sleep, protein, blood sugar control, reducing stress, and if needed, hormone replacement therapy, right? You don't have to be completely tanked before we start hormone replacement therapy, right? It should be used to kind of cushion that and take over and still the body to be able to produce those have those hormones in the system when the body is not producing them on their own. Super important.
Absolutely. And so, what are your top 3 actionable tips for clients trying to balance hormones while training?
Okay. Weightlifting 3 times a week.
Yeah.
Eating protein, both throughout the day and every meal of the day, but also within 60 minutes of that workout, right? Because that's when that muscle rebuilding starts. And if you go do a massive workout, your body does have, not injury, but when we're building muscle, we actually have to break apart muscle fibers to build them stronger. If we don't have protein in there, the body starts to pull it from other places, and we're actually losing that momentum. And then getting enough sleep.
Yeah.
Do it. I literally wrote an exclamation mark in my notes. Do it like it's your job.
Happy day. I can sleep like it's my job. That's happy.
Yeah, it's great. I prioritize sleep so much because, it helps you kind of get into that next day and function. If you're sleep deprived and each day it's chipping away, then the body's not optimized and you're not then able to make the progressions that you want to.
Exactly. Thank you for that. So that's the first.